This video is about how you can implement case taking in epidemic diseases in your clinical practice. The secret to selecting the most appropriate homeopathic remedy for an epidemic disease is by carefully examining the first several cases that come to your clinic. You have to compile all the signs and symptoms, construct a totality, and then arrive at the most appropriate remedy. First, I will explain why do you have to examine several cases. Then I will move on to the most common application of this method in clinical practice. When you examine several cases, what happens is that you get more characteristic symptoms. First of all, the generals become more defined. If the patient is sleepless, you get an idea if the patient has difficulty falling asleep or he sleeps for a short time and then wakes up, etc. Not only these generals, but the chief complaints also become more meaningful. Maybe we get a better picture of the sensation or the modalities, maybe some cases present with certain concomitants. In few rare cases, you see some special symptoms or a peculiar combination of symptoms which may not be present in others. People have different constitutions, so even though it is the same epidemic disease, they may show special symptoms or special combination of symptoms. Since the source of the disease is the same cause or the same epidemic, you can include these special symptoms into the totality. Then from this totality, you can arrive at the most appropriate homeopathic remedy for this epidemic disease. You can make use of this method in your clinic. Once you start practicing, you will get to see seasonal outbreaks of viral fevers or dengue fever or diarrheal diseases, etc. Trust me, this method is highly useful and practical.